We are taking a rare look inside the operating room as Motto is getting a weekend lift. It's sort of like a facelift, except you can get it done on a Friday and be back to work early the next week. Now, the left side of her face is complete. Doctor, what are you doing right now?
At this point, what we're doing is we're closing up the extra skin that we took away with fast-absorbing sutures, which means the sutures fall out on their own, so she does not have to come back and have them removed later. Previously, what we did was we redraped the undersurface of the skin, removed any extra skin that was not needed, and now we're just closing it up for her so that she has a real nice result.
Okay, and you say that she will not have to come back and get those stitches removed, but she will be coming back and you'll be checking on the healing process.
Absolutely. She'll be back to see us next week to make sure things are going okay for her, but she will not require suture removal at all.
How long will it take for those wounds to heal up?
Oh, within a week. The sutures will fall out on their own, and then the wound will start to heal. And within about 7 to 10 days, she'll be able to put makeup over it and cover it up and go out and do everything she ever wanted to do.
Wow. What's next? What are you working on next?
After this, what we're going to make our move to is the neck area. And we're going to sculpt the neck with liposculpture to kind of help redrape the sagging skin underneath the neck.
Okay, we will check back with Motto in just a few minutes. For now, Allison Alexander, 19 Action News. A 1-hour facelift. See the doctor on Friday. Be back to work on Monday with a new face. And it's not just for women. We want to warn you, however, some of the pictures are indeed graphic. Here's 19 Action News anchor Allison Alexander now at 5. Yeah, we're bringing you a rare look inside the operating room as Motto here is getting a weekend lift. First at 4, we brought you the first part of the weekend lift, and now she is getting the second part, which is she's getting sort of the fat sucked out here of her neck to make that neck look more youthful, I should say. Doctor, explain to us briefly the first step and then what you're doing now.
The first step, which we just finished, was the redraping of the excess skin on the upper and middle portion of her face. At this point, what we're doing is we've moved down to the neckline, and we're trying to sculpt the neckline for Motto to give her that nice, rejuvenated neck. And at this point, what we're doing is just sculpting out any of the extra fat tissue that she has in the neck.
Now, I've noticed she is not bleeding very much. Is that partly because of the anesthetic that you gave her?
That's correct. We use a special tumescent anesthetic that allows the small blood vessels to constrict or shrink down so that there's almost a bloodless field for us.
How long does this part of the procedure take?
This takes approximately 20 minutes.
And the incision there is very small.
We use very small cannulas and very tiny instruments to help rejuvenate the lower portion of the neck, and thus allows her to have a quick and easy recovery.
Okay, what's next?
The next portion of it would be to go back to the other side and finish the redraping of the neck, and then finally take care of the laugh lines with Restylane, which is a sugar-based filler that we like to use. It lasts approximately 6 to 9 months, and it really helps plump those laugh lines into a nice, more rejuvenated fashion.
Okay. We will check back with Motto in just a few minutes. For now, Allison Alexander, 19 Action News.